So number one on our list was that praxis is an essential component of assessment across all ages. I think I certainly was guilty before I started my training in thinking that it wouldn't be as relevant as it actually is in my clinical setting, which is adult mental health.
Yeah, definitely. And it's only after a while of doing it that you realise it literally is everywhere, that you need to be thinking about it with every person you work with, that there's so much more than just modulation. So another thing that I wish I'd known was kind of on the flip side of that, how big a factor sensory aspects are on our mood. I don't think I realised quite how much that alters how the people I work with day to day are feeling, what might trigger someone, what could cause someone to completely change from being calm one moment to the next seeming like they can't, interact or deal with anyone around them. I don't think I had an awareness of exactly how important that was.
And I think when you gain that awareness, it's very hard to unsee it afterwards. So any patient presenting in the way that you've described, you automatically think, and what's the underlying thing here? Yeah. Which brings us on to, I suppose, the next thing, which is that, how you explain sensory integration to your clients. How do you get their buy-in with it, but also how do you explain it to your management? How do you explain it to your colleagues? Because this was something that I struggled with prior to my SI training, and in terms of advocating for myself as to why I needed to do the training to serve my client group in a way that I felt they needed. It would have been really great if I had that ability for the training.
Yeah, and an awareness of quite how much neuroscience behind it, because I completely cringe now when I think of some of the ways I explain things, and probably how I just didn't feel confident at all that what I was saying had much of a foundation, because I just didn't know. Whereas I think building that knowledge of all the science and all the neuroscience that I guess is important to it, I think lets you explain it so much better than when you're just trying to kind of muddle through.
Definitely. And I think it's a really important point, actually. And our last point was that sensory integration, it's not an idea, it's not an answer, it's a perspective. And this is something that I didn't understand before doing my training, that the training allows you to widen your thinking and to encompass new pieces into your assessment and intervention process, and it influences your clinical reasoning quite significantly. But it's certainly not a list of ideas that you can try. And that's really important to know, because, that's not what you're going to get.
Yeah, and that is the foundation for everything we do. It is part of everything someone would do during their day-to-day life, but that doesn't mean that SI as a therapy is always the answer. So we always need to consider it. We always need to look for how it's impacting on someone. But yeah, it doesn't mean that they all need this high-level assessment or high-level therapy in order to function day to day.